Chalo, let's start with cranial nerves. Okay, when we talk about the cranial nerves, we have 12 cranial nerves. Now, one thing I'll be actually covering up brain, general anatomy of the brain a little bit, and that I have planned to match it up with before physiology CNS class, so that you have an orientation of anatomy of the brain before we go into the physiology of it. Although are other things in anatomy as far as the nerves and all those things, when we start down nerves and just go downwards, we are not actually much dependent on anatomy of the brain. We are more dependent on the anatomy of the brain for physiological purposes. Okay? So that's why I've just planned to cover up. At end of the anatomy will be something like brain, and then we start up the physiology of brain. Okay? Anyways, you'll be informed on that. Now, when we have this cranial nerves, we have first 2 cranial nerves come from forebrain. Next 2 cranial nerves come from midbrain, that is oculomotor and trochlear. Next 4 comes from pons, and next 4 comes from medulla. So all you need to know is the sequence of forebrain, midbrain, pons, and medulla, and hopefully you all know that, isn't it? Once you know this, 2, 2, 4, 4. That's it. Okay? And name of the nerves, yes, it's expected that after so many years of dentistry, you need to know which nerve is 5th nerve, what is the 7th nerve, what is the 9th nerve, and all that. Okay, I'll move on with this. Now, there are some more facts associated with it. When we talk about the brain stem, some of the nerves come from the front, the ventral side. Some of the nerves come from the back side, and some of the nerves come from the sides. Now, if you look at this, to remember these very numbers, it becomes tricky. So, don't remember everything. First thing is, remember the only nerve that comes from the dorsal aspect. We have been talking this in our revision sessions also. So, it's the 4th. Isn't it? 4th has a lot of things which are different from the other nerves, isn't it? It is the only nerve coming from the dorsal aspect. It is the only nerve that decussates to supply the contralateral muscle other than the optic nerve. It is the only nerve. It is a nerve that has a longest intracranial part. Yes. So you all remember all that. It is the slendermost nerve. It is the one that has the least number of fibers in it. Okay. So it is a very commonly involved nerve in, yeah. Okay, tell me the answer to a question. Which is the nerve that is involved in diplopia on looking downwards and laterally? 4. So even this is the one, SO4. Yeah, so you guys are good with it. So now we were talking about the nerves with the dorsal attachment. Now nerves with the ventral attachment. Again, this sequence is also simple. You see, pura 3 ka table hai yahan pe. But it's just the multiple. 1, 2, 3 likho. Uske baad 3 ko 2 se multiply karo. What you get is 6. You multiply 3 by 2, you get is 6. You multiply 6 by 2, you get 12. How I do is, I write 1, 2, 3. Then I multiply 3 by 2, I get 6. Then I multiply 6 by 2, I get 12. This is how I remember the nerves with ventral attachment. Once you have nerves with ventral attachment and the dorsal attachment, once the 13th tak remove all the other nerves, you get the remaining nerves. They are the ones with lateral attachment. Isn't it? As simple as that. You will remember it now and here itself. Okay? Other points, most slender, longest intracranial, we have already done. The direct extension of brain is your optic nerve, and the largest cranial nerve is our nerve, that is the trigeminal nerve. Isn't it? When you talk about the olfactory, can you all tell me where does the olfactory bulb sit in the skull? Cribriform plate. Perfect. Cribriform plate is a plate that is seen on adjacent side of the crista galli. What bone is that? Teeth mold. So you all are oriented with that. Now, Now when we talk about this nerve has simple fibers. You know, they have bipolar neurons. So you have one process going this way and the other process going towards the brain. So these bodies, they are present in the olfactory bulb, and the fibers, one end of the fibers hang into the nasal mucosa. Okay, now if you see, the most sensitive part is somewhere here at the top of the nose. If you actually smell something deep, then the things reach there and then you actually smell it severely, isn't it? Because you have all your sensory things over there in the upper zone because of these hanging fibers. Priyanshu, अभी तो पूरा का पूरा bandwidth है. Others also feeling that? Okay. Then I should. Okay. Hey guys, 3G, Reliance 3G has come. I mean, is it available for buying? The 21 Mbps speed? Are you sure? Anybody has bought it? Because in selected cities, huh? It's not too far. We are all gonna have very nice speeds of internet. Anyways, right now it's manageable. Yeah, Reliance Broadband Plus, we do also have it in the center. We were looking for 3G, but they say it's not there for another 3 months. So I was just wondering if we have it at some place. Okay, let's get back to our olfactory nerve. Okay, olfactory nerve, we have these fibers over here, and then this portion goes back into the brain on the lower side. Hey, do you remember that thing which we were talking about when we were talking about the olfactory tract, you know, uncus, and there was something, what is that? Anterior perforating substance. Okay, so this is just for the thing, you know, we have an olfactory bulb, then the tract goes and it is divided into this lateral and medial stem, and in this side you have that cerebral cortex, on the other side you have the branch of the optic chiasma, and in between you have the anterior perforating substance. So just recall that picture again over here, and with this we'll move on. Now this cranial nerve is olfactory, you know, sensitive to the olfactory mucous membrane, and there's nothing much about this which is asked in it. So we'll move on with the optic nerve. Optic nerve is not a true cranial nerve. This point is an MCQ. And if you cut this nerve, it cannot regenerate. It doesn't regenerate because it doesn't have a neurilemomal sheath. Because whenever a nerve is you know, damaged or anything, to regenerate it needs this sheath. Otherwise, how can it just sprout and grow into, you know, the tube and all that? So it cannot regenerate. This nerve is considered direct extension of brain. Now we have seen retina. Retina is considered a part of optic nerve. It is considered as a terminal sensory parts of the optic nerve. So it is all this. Retina plus optic nerve is actually the extension of brain. Okay, so it develops as with retina as a lateral diverticulum of the forebrain. Okay, when we come to the third nerve, the oculomotor nerve, from here we'll start talking about our parasympathetic ganglions. Okay, now when we talk about the third nerve, the nerve itself is oculomotor, as we have seen in the muscles of the eye. Now just recall the muscles and all those things, okay? In the muscles of the eye, we were talking, all the muscles of the eye are supplied by the third nerve except SO4 and LR6. So we are talking about the third nerve, oculomotor nerve. Other than the branches for the muscles of the eye, it also conveys preganglionic parasympathetic fibers to ciliary ganglion and sphincter pupillae. Which zone of the eye your sphincter pupillae muscle was? What was that part called as where you had your sphincter pupillae muscle? This was the lens. What was that part where you had your sphincter pupillae muscle called as? Iris. Okay. Now Hema, when we compare pupil and iris, yes, uveal tract is fine. Yeah. Your pupil is this portion between the iris, isn't it? And your iris is that pigmented zone hanging over there. Okay? Yes. So those two actually receive the parasympathetic fibers. Now let's see about the parasympathetic fibers. Now when we talk about the oculomotor nerve, do you remember based on that slide of its attachment, dorsal attachment, ventral attachment, which side? Yes, Uday, I will repeat it. Let me complete the question. Which side is your third nerve attached? Is it dorsal, ventral or lateral? Okay, so with that mathematical formula, isn't it easy to remember that it's on the ventral side? Yes, perfect. Okay, Uday, actually in the last class, I don't know whether you were there or not, we covered up the general anatomy of the eye. Okay, you were there? Yeah, so the recording of it would be available in that, I think so. It was first part, right? Not the second part or first part. I don't remember. Yeah, it's the part 2. Muscles. Okay? So just watch the recording because it's a whole part. The anatomy of total eye was there. So probably if you see it whole, you will be able to understand what iris was. Okay? Yeah, we'll move on with it right now. When the nerve comes out from the ventral aspect of the brain, then it runs through the lateral wall of the cavernous sinus. Okay? In the brain, if you imagine, this is somehow your brain would be. This will be your thing. And where it will sit? It will sit in the cranium like this. Isn't it? Now when we talk about the cranium, in the middle cranial fossa, you have your sphenoid bone, and alongside the sphenoid, you have your cavernous sinus. Able to imagine the location of the cavernous sinus? This is the sphenoid, body of the sphenoid. On either side, you have the cavernous sinus. So these nerves, they are coming out from the ventral surface of the brainstem, and then they pass through the cavernous sinus. Okay? Here? Then, when they pass through cavernous sinus, your third nerve occupies the topmost position in the cavernous sinus. So it passes through the lateral wall of the cavernous sinus, then enters the orbit through superior orbital fissure. Okay? Before it enters the orbit through the fissure, it divides into superior and inferior branches. Note this term before, very important MCQ. Okay? Now, if you remember your anatomy of the bony cavity in there, okay, in the anatomy of the bony cavity at the apex, just lateral to the optic nerve, you have ciliary ganglion. Okay, ciliary ganglion receives the preganglionic parasympathetic fibers. Okay, don't get panicky when you see these terms. Okay, preganglionic, parasympathetic. It's not that difficult. It's simple. Okay, just be with me. The preganglionic means right now they have not relayed. They have not gone into any ganglion. So, and they are parasympathetic. When we talk about parasympathetic, let me just give you a small picture. You know, this is our head, our brain. This is our spinal cord. Okay, so we have parasympathetic and sympathetic system, that is ANS. Okay, parasympathetic comes from the cranial region and sacral region. Okay, when we talk about sympathetic, it comes along the thoracolumbar region. Okay, it's a part of the brain that is sympathetic and parasympathetic. Now, there is very important thing about parasympathetic is, parasympathetic will have a long course before they relay into their ganglion. Okay, so their ganglion are situated close to the organs. They are not situated close to the brain. They are situated close to the organs. The way ciliary ganglion is. You know, it's situated so close to the eye. It's not close to the brain. Are you understanding this fact? But when we talk about the sympathetic, in sympathetic what happens is immediately they come out, there is a chain of ganglion here itself. Okay, this chain of ganglion will relay the fiber. Here the fibers will relay, and postganglionic fibers are long and then they reach the organ. So sympathetic, they have a short preganglionic and long postganglionic fibers. But when we talk about the parasympathetic, they have long preganglionic and short postganglionic fibers. Okay? Yeah, with this basic information, we'll move on to our this thing where we were. Okay, so here we have the ciliary ganglion. Ciliary ganglion receives preganglionic parasympathetic fibers from the third cranial nerve. The third cranial nerve, what it does is, it brings those fibers with it. When we talk about a nerve is nothing but a collection of nerve fibers. So this nerve, that is the third nerve, it is carrying some motor fibers and it is also carrying some parasympathetic fibers. It will carry those fibers and take it to the ciliary ganglion. Okay. Also, it receives postganglionic. See why we say postganglionic sympathetic? Because sympathetic ganglions are already situated close to the spinal cord. Sympathetic has already relayed, isn't it? So postganglionic sympathetic fibers from plexus over the internal carotid artery, and also it receives a sensory route from nasociliary nerve. Let me just show it diagrammatically. Do you see this diagram? Okay. Now, this is pink colored is your third nerve. Okay, do you see the orange colored fibers? The orange colored fibers are preganglionic parasympathetic fibers coming from your cranial region of the autonomic nervous system. Okay, now these fibers, they come and they relay into the ganglion. This ganglion is ciliary ganglion. Okay, once they relay into the ganglion, they get converted into postganglionic fibers. Now these postganglionic fibers go through short ciliary nerve. Okay, see this? And they supply the constrictor pupillae muscle in the iris, isn't it? Okay. Yes. Now one more thing about it is, do you see this internal carotid artery? This internal carotid artery has a plexus. What is this plexus made up of? The sympathetic fibers that are already relayed, the sympathetic fibers from the spinal cord that are already relayed in a ganglion, that is sympathetic ganglion. The postganglionic, from there they come and they make a fiber, plexus on the artery. Yes. So they are postganglionic sympathetic fibers. Okay. Now they come from here. They go into the ciliary ganglion, but they don't relay there. They don't again relay there. Okay. They just pass uninterrupted. They pass uninterrupted and then they go and supply through the ciliary nerve again, short ciliary nerve again. Okay, does it make it clear? Other than that, do you see this nerve ganglion? What is this? Your trigeminal ganglion. It is also lying very close to, if you actually remember the skull right now. In skull we had the sella turcica, and alongside we have the cavernous sinus. Somewhere there our internal carotid artery actually goes through inside the cavernous sinus. Somewhere here you have the petrous temporal ridge, remember? On both the sides, remember the diagram, okay? It's very important for you to remember anatomy in a sequence. And on that petrous temporal ridge, your trigeminal ganglion sits. When your trigeminal ganglion sits there, it is very close to the artery, isn't it? So you can feel the closeness over here. Now this trigeminal ganglion gives a branch, that is the nasociliary nerve. The ophthalmic branch, and then it has a nasociliary. Yes. Okay. And that nasociliary nerve actually gives the communicating branch to the ganglion. Now you can summarize. So these are just the sensory fibers which are actually carrying the sensation back through the trigeminal itself. But they are coming through the ganglion. Okay. Now if you summarize, what does your ganglion contain? It contains the preganglionic. It receives the preganglionic parasympathetic fibers through third nerve. It receives postganglionic sympathetic fibers from plexus over the internal carotid artery, and it receives sensory fibers from the nasociliary nerves. Clear with all the content of the ciliary ganglion and its position. Okay. Now, where exactly it's getting its fibers from? Now the question arises, from where is third nerve getting the parasympathetic fibers from? Remember, we know that it's coming from brain in the central region, but it's coming from Edinger-Westphal nucleus in the brain. This is one thing you need to remember, that's it. Okay, from there you know the course now. From there it goes to cranial nerve, third cranial nerve, then it relays in the ciliary ganglion. The postganglionic form the short ciliary nerve and supply the sphincter pupillae muscle. That's it. Okay. Now we know that third nerve supplies all the muscles of the eye except for SO4 and LR6. It also supplies the constrictor pupillae muscle. Right? See this? And remember the ciliary muscle and its location? It was in that ciliary, that uveal tract ka place. Isn't it? You can see it in this diagram. Here you have the ciliary body and ciliary muscles. All these are supplied by your third nerve. Okay. That makes it simple for you to understand what will happen if your third nerve is resected. There would be ptosis because the levator palpebrae superioris is also supplied by the third nerve, so this will hang down. Okay. There would be a divergent squint. Why divergent squint? Because all the other muscles will get paralyzed. But lateral rectus is not paralyzed because lateral rectus is supplied by the sixth nerve. Now this lateral rectus will cause the eyeball to rotate laterally. And you will notice that both the eyeballs have gone outside. That is the lateral squint. There would be dilatation of pupil because your muscle is paralyzed that was supplying the constrictor pupillae. So it will get dilated. And obviously when so many muscles are paralyzed, how will the eye accommodate? It will have double vision and loss of accommodation. Hopefully all the points clear till here. Now let's come back to the fourth nerve, the trochlear nerve. We know it quite well now anyways, isn't it? It is the only muscle that is coming from the dorsal aspect. Once it comes out from the dorsal aspect, again it runs in the lateral wall of the cavernous sinus. Now, if you remember the diagram that we already saw for the third nerve, you should be able to recall where does your fourth nerve sit. Wasn't it just below the third nerve? Isn't it? In the lateral wall. Okay? So, it actually goes just below. Topmost is the third nerve, then you have the fourth nerve. Between third and the ophthalmic nerve, that means below the third nerve and above the fifth nerve, that is the ophthalmic branch of the fifth nerve, it enters the superior orbital fissure. Lateral to the tendinous ring. Now, there are many questions on this tendinous ring and the entry of the nerves into the superior orbital fissure. Okay? I'll be back. But I think so. Okay. Able to hear me? Okay, give me a minute, okay? So we were at fourth nerve and oh my god. My point is visible, right? So we were at fourth nerve and now in this, again this runs just below the third nerve and it supplies SO4. And it is a muscle that causes diplopia on looking downwards and laterally. Now in our muscle class, we discussed the action of the muscle superior oblique, isn't it? And that is where we come to know why we have diplopia on looking downwards and laterally when a superior oblique is paralyzed. Okay? So I'll not go into that details in here again. Okay, if you have still the doubts, you can just refer once the movement of that. And it's very important for you to actually able to draw that circle to understand the movement of the muscle. Okay, now this chart, again, remember, there are 2-3 things which you can actually think theoretical and then remember this diagram. Remember when we were talking about the third nerve, I said that it divides before entering the fissure, before entering the superior orbital fissure, isn't it? Now since the nerve divides before entering the superior, I am talking about the third nerve, okay, oculomotor. Then we are expected to see 2 branches over here for the third nerve, isn't it? Let's see third nerve here and third nerve here. Yep, we see 2 branches. Where are they? They are inside. Thankfully, both of them are inside. Okay, so that we abhi ek headache to khatam ho gaya ki which branch is outside and which branch is inside. Both are inside. Okay, but there are two. Now, if you notice fourth wasn't divided. It just entered it. Where it entered? Outside the ring. So third to inside, but fourth is outside. Now, at this moment, just remember this much. Okay, when we talk about the fifth nerve, okay, fifth key branch, which is the branch of thalamic, then again that is the only one extra nerve that will be coming over here. We'll be talking about that again in the sixth nerve. Isn't it? Actually, we are supposed to know third, fourth, fifth and sixth when we talk about superior orbital fissure. Right? So always question yourself, are you able to locate all the four nerves in there? If yes, then you are able to solve all the MCQs on this. Let's come back to trigeminal nerve. Now, trigeminal nerve is a nerve which I expect you all know very well. So we don't have a lot of, detailing out of the nerve. We have a gross view of it. We'll be concentrating more on its parasympathetic connections with the seventh nerve and all that. So our trigeminal nerve is the largest cranial nerve. We already saw that its Gasserian ganglion, was sitting on what ridge? Where it was sitting? Your Gasserian ganglion? We saw it very near to the internal carotid artery, right? Petrous temporal bone. Which side of the petrous temporal bone, if I ask, is it situated on the lateral side or the medial side of the petrous temporal bone? Medial or the lateral of the petrous temporal bone? Because petrous temporal bone is a long bone, right? Medial or lateral? Yes, anterior and medial. Perfect, Hima. So that makes me sure that you all have a good picture of the petrous temporal bone in there. Okay, that's nice. So that is where your Gasserian ganglion was situated. It's a crescent-shaped ganglion. So when we talk about the crescent, roots are coming from the convex portion. Again, this is an MCQ. Okay, now when we talk about this, you have MCQ here, you have MCQ here, you have MCQ here, you have MCQ here, everywhere. Okay, there are lot many MCQs frameable on this zone of nerves. Right? There's one more thing you notice here. There are pseudo-unipolar nerve cells in the Gasserian ganglion. When we say pseudo-unipolar, these are the nerve cells that come out as a single branch and then they divide into the two branches. Okay, so yes, they appear for some portion as if they are unipolar, but it's pseudo. They get divided later. This nerve, that is trigeminal, is mostly sensory with a small motor root that joins the mandibular nerve once it enters the foramen ovale. Now, we all very well know that the motor root joins the mandibular nerve. But when it actually passes with it through foramen ovale, but joins it after exiting out from the foramen ovale. That's an important question again. Okay, so now we know that trigeminal nerve has three branches. The ophthalmic, which we saw was entering into the superior orbital fissure. Second branch, the maxillary, that goes through foramen rotundum. After foramen rotundum, it will go to the pterygopalatine space, that isn't it? And then it will enter the orbit through infraorbital fissure. Okay. Then you have mandibular nerve that is not coming into this zone. It is exiting here behind, inside the mandibular region from the base of the skull through foramen ovale. Ophthalmic branches. When the ophthalmic nerve comes out, it gives the cranial. See, mostly all of them, all the branches, be it ophthalmic, maxillary or mandibular, everybody is giving a nervus tenturi branch. Okay, that is supplying the meninges of the brain. That is why whenever you have a toothache, you have a headache. Okay, because there is so much common supply coming from head and the jaws, teeth. Okay, also it gives communication to third nerve, fourth nerve and sixth nerve. Then it passes in the cavernous sinus. Now at this time, do you remember the wall of the cavernous sinus? Topmost mein we had third nerve, then we had fourth nerve, and then we have fifth nerve. Where is sixth nerve? It's inside the cavernous sinus. It's in the, it's inside the cavernous sinus. With internal carotid. Yes, perfect. Okay. After that it gives three branches. The lacrimal branch, that gives the branch to the lacrimal gland, conjunctiva and skin. Now this branch is very important. Okay, don't forget guys, this is the branch of ophthalmic nerve. We'll be talking about this branch again with the ganglion. Okay, then we have frontal branch. Frontal branch that gives supraorbital and supratrochlear branches. Now this is a simple branch. This frontal branch comes, it gives the supratrochlear and supraorbital which comes out and actually supply the skin over here. Right? So this is a simple, but lacrimal is the one which we'll be seeing again. See here, the postganglionic fibers from sphenopalatine ganglion to the lacrimal gland. We'll be talking about this. Then we have the nasociliary nerve. Nasociliary was a branch that gives long ciliary. Now do you remember we were talking about a sensory branch that was coming to the ciliary ganglion? Think about it. We have a nasociliary branch of the ophthalmic, that is of the fish, trigeminal, and it is giving a branch to the ciliary ganglion. Other than that, posterior ethmoidal and anterior ethmoidal are the branches of the nasociliary. Posterior ethmoidal and anterior ethmoidal, they enter through the mesial wall of the nose, okay, and they supply the ethmoidal air cells. Okay, then we have the nasal branches that will go down, through the nasal cavity and then all those things over there. Here we can see it nicely. This is the ophthalmic nerve. Okay. The nasociliary has given a connection to the ciliary ganglion. Ciliary ganglion then gives out the short ciliary nerve, isn't it? Nasociliary directly gives out the long ciliary nerves also. See that? When it goes in front, it gives anterior ethmoidal and posterior ethmoidal not seen over here. Okay? And then the nasal branches that go down the nasal wall. Now, if you see this part, the frontal nerve is simple, just the supraorbital and supratrochlear, and they come out on the skin. Okay? Now you see this branch, the lacrimal nerve, it's going to the gland, but these fibers which are going to the gland are not coming from trigeminal nerve. We'll see where they come from. Okay, there needs to be some cross communication which is bringing those. So keep this point open in your brain because we are going to make a connection there. Okay? No, Priyanshu, intraorbital is not. Infratrochlear. Intratrochlear is this one. This continues as intratrochlear, yeah? The nasociliary. It's not frontal. No, he is not asking about infraorbital. He is asking about infratrochlear. isn't it? Okay, so here we move on with the maxillary nerve. Now maxillary nerve. Actually, yeah, anterior ethmoidal branch. Yeah, it's a branch of anterior ethmoidal. That's what you want to say, the hemabindu, right? I mean, see this. Here you have anterior ethmoidal. Before anterior ethmoidal goes inside, there is a branch that comes out. That is infratrochlear. Okay. Supratrochlear was a branch of your frontal nerve. Clear? Now let's go on to the maxillary nerve. Now this maxillary nerve, it gives the middle meningeal nerve inside the cranial fossa. Okay. Then where it comes out of the cranial fossa, it comes out through foramen rotundum. This rotundum is situated where? Which bone? Sphenoid bone. Perfect. Now this sphenoid bone में rotundum में से घुस के where will it go? Where will this go? It goes into pterygopalatine fossa. Okay. When it goes into the pterygopalatine fossa, okay, in the fossa it gives zygomatic nerve, it gives pterygopalatine nerve and PSA. Now let me not confuse you here. Let me go to diagrams before we actually see this. Okay. I'll be jumping just here and there on the slides depending on this. Yeah, this is the maxillary nerve. Do you see this? Notice this? Yeah, it is coming through foramen rotundum here. Okay, here when it comes inside, let me draw blue colored space. This blue colored space is your fossa, pterygopalatine fossa, and here was the opening, rotundum, that is bringing the nerve into the fossa. Once it comes into the fossa, it gives the rootlet, and there is a ganglion hanging over here. Do you see the ganglion hanging? This ganglion is your pterygopalatine ganglion. Okay. Right? And after that, this ganglion will, do some golmaal, and then the nerve continues, and then nerve continues as infraorbital. It goes through the inferior orbital fissure. Your inferior orbital fissure is nothing but it is a communication of the fossa to the eye. Inferior orbital fissure में जाके it lies into that canal that runs through the floor of the orbit, and then it comes out on the face over here. Are you able to imagine the facts? And then it gives the branches on the face. Okay. Now the question arises of this ganglion and the branches, isn't it? Now what happens is, this ganglion, although it is hanging from maxillary nerve, but it is not a ganglion of the maxillary nerve. Actually, it receives the fibers from the seventh nerve, that is facial nerve. Now, where is your facial nerve? If you remember grossly, your facial nerve is in the ear. Okay, it traverses through the ear. Right? So, in the ear, facial nerve has two bends. One bend is called as genu. From this bend, one branch comes, that is greater petrosal nerve. This greater petrosal nerve is a parasympathetic fibers that are coming from your head through the facial nerve, and now they are going through the greater petrosal nerve. Okay, so parasympathetic fibers यहाँ से आ गए. Okay, and they will go to the ganglion. They will relay in ganglion. After relaying in the ganglion, post-ganglionic fibers will go into the maxillary nerve. Okay? Clear till now? Any doubts? Yes. Now, there are also fibers coming out of internal keratid, that sympathetic fibers, the same fibers which we are going to ciliary ganglion, right? Similarly, fibers also come to pterygopalatine ganglion. Yes. Now, these fibers will pass uninterrupted. They will not relay there. They will pass uninterrupted. Okay. And once they pass uninterrupted, again they will continue through the branches. So that's what is our pterygopalatine ganglion about. But now we'll go back and see the branches. If we just go back and see the branches, we were talking about the zygomatic nerve. Zygomatic nerve is a branch of your maxillary nerve, which is given in the pterygopalatine fossa. Do you remember the lacrimal nerve? I told you to keep the, connections open there. Do you remember the lacrimal nerve? This one, which I told you to keep the connection open. Okay, this is in the eye. Okay, this is in the eye in the upper zone, but your maxillary is coming in the lower zone. The infraorbital fissure वगैरह से it's coming in here, isn't it? From that lower zone, before it is actually going into the infraorbital groove. Before that, just in the pterygopalatine ganglion itself, it gives a branch that is called as zygomatic. Okay, I'll show you in this diagram over here. Do you see this? This was a pterygopalatine ganglion, and इसमें भी इतना अच्छा नहीं है. Wait, I have one more. Yeah, here I can show you better. So this was the pterygopalatine ganglion hanging from the maxillary. Okay, and here it gives a zygomatic. Okay, do you see this zygomatic branch is actually going and joining a branch here? This branch is nothing but lacrimal. See that? So the fibers which are actually coming from the seventh nerve are now going through zygomatic and going to lacrimal and are supplying the lacrimal gland. Okay, I really always wonder how the anatomists have found this out. पढ़ना ही इतना मुश्किल है, उनको मिला कैसे ये? Isn't it amazing? Yeah, really amazing people, इतना सारा ट्रैक पता करके उसको मॉड्यूलेट करना एंड देन उसका मतलब इट्स अमेजिंग. देखिए, सो दिस वाज द pterygopalatine ganglion. पोस्ट गैंग्लियनिक फाइबर्स ऐसे जाके इट कॉन्टैक्ट्स दैट. Are you clear with that? Okay, so now if I read this chart, you should be able to understand it. Okay, we started from seventh nerve, fine. But before that, we have lacrimatory nucleus, from where the actual parasympathetic fibers are coming from. From the lacrimatory nucleus, the fibers come to seventh nerve. Genu of the seventh nerve gives greater petrosal nerve, right? We remember a sympathetic branch coming from the deep petrosal nerve. That was sympathetic branch coming from the internal carotid artery. That was deep petrosal nerve. Both of them join together to form a nerve that is called as Vidian nerve. After that, it goes to the pterygopalatine ganglion. From the pterygopalatine ganglion, postganglionic fibers enter the maxillary nerve. Okay, imagine with me. Okay, don't only let me speak. And then from there, to the zygomatic, Zygomatic connects to the lacrimal and then to the lacrimal gland. Too much of jumping, train changing, local में travel किए जैसा है मुंबई की, isn't it? So that is how कितनी मुश्किल से you get fibers to the lacrimal gland. So that's why girls use it very often. At least कुछ तो use करना चाहिए इतना fibers का. इतना connection बनाया है भगवान ने तो. Okay, so hopefully you remember all this. See greater petrosa, deep petrosa. इसका नाम क्या है बताओ? Combination. What is that called as? Median nerve. Okay. Yes. All done? You want me to repeat in this diagram? I think it's clear with you all. I'll move on. Tired. Okay, mandibular nerve. Mandibular nerve mein there is this nervus spinosus and nerve to internal pterygoid. Okay, mandibular nerve is coming out of your foramen ovale. As soon as it comes out of the foramen ovale, it is, motor nerve will now join it. Motor nerve join ho gayi, so there is a part that is undivided. Okay, that undivided zone gives nervus spinosus and nerve to internal pterygoid. Okay, nerve to internal pterygoid is important because it gives branch to tensor villi palatini and tensor villi tympani. Okay, then it divides into two parts, the anterior and the posterior. Anterior has all the other muscles supplied except the medial pterygoid. Okay, it's a motor thing, but it does have a small sensory component that is called as long buccal. Okay, now this long buccal, actually it goes and it pierces the buccinator to come and supply the skin on this region. Although it pierces the buccinator, it does not supply buccinator because it is a sensory nerve. What nerve supplies buccinator? Fascia. So you all are good at it. Okay. Then we have the posterior division. Posterior division में auriculotemporal nerve है. Okay. Now do you remember the auriculotemporal nerve? We discussed it in revision also. Yes, this is the one that goes to TMJ, and this is the one that comes out as, two rootlets, and it surrounds an artery. What is that artery? That loop. Loop के बीच में middle meningeal artery. Where does it enter back the skull from? What is that foramen through which your MMA enters back the skull from? Foramen spinosum. So there is a question actually that asks you that auriculotemporal is closely related to which foramen? And the answer is foramen spinosum. Now, hopefully you understand how it is related to foramen spinosum because it lies just below foramen spinosum, isn't it? People say वो foramen spinosum में घुसती भी नहीं है, निकलती भी नहीं है, तो how it is related to foramen spinosum? This is how it is related to foramen spinosum, and that is how the question is framed over there. Okay. Then we have, that was auriculotemporal, and uske baad then we have, lingual nerve comes out, and inferior alveolar nerve goes inside the mandibular canal, and it runs inside your mandible to supply the incisive, to supply the teeth, and then it comes out over here to supply the skin. Okay. Now if you remember, whole of your face is supplied by trigeminal. Abhi हमने देखा कि ophthalmic is supplying all this zone. Your maxillary comes out on the face and supplies all this zone. And your mandible is supplying all this zone. What part is left out? This angle? Isn't it? Think. Okay, that part is left out. So I would suggest open a picture of that sensory supply of the face in Chaurasia. Yes, and just today, see what nerve supplies that. Okay, if you at least do it by yourself, you will never forget it. Fine. So you all know all this now. Here is the diagram. You can actually see it. This is our auriculotemporal, how it comes out. Okay. Now let me tell you one more cross connection. Yes, Meera. Let me tell you one more cross connection. We have already discussed our pterygopalatine ganglion or our ciliary ganglion. Now we are supposed to get into our otic ganglion. Now otic ganglion, if you see it here, this nerve is your ninth nerve. Your ninth nerve, that is the glossopharyngeal nerve, it gives the branch. I have a bigger diagram, I'll go there. Where is it? Yeah. See this? Yeah, it gives the branch that is a tympanic branch. Yes, Hima, I think so everybody has been mucky. There is a tympanic plexus. Tympanic plexus, the lesser petrosal comes out. Okay, just be very careful about lesser. Because deep petrosal was what? Deep was a branch of? That's why I asked you that. It wasn't a branch of seventh. It was sympathetic. Yes, it was sympathetic plexus के ऊपर वाला branch. This was the deep petrosal. What was the branch of seventh? Greater petrosal. Okay, अभी when you see it, you know, बहुत easy लगता है. You have to actually go through it many times for you to remember it. Okay, but it's nice if you feel it easy. Also, even that is more than enough, because it's like many people don't understand this part. Okay, then we have this lesser petrosal. It goes into the otic ganglion. From the otic ganglion goes into the auriculotemporal, and auriculotemporal carries it to parotid. External petrosal, is it another term for greater petrosal as far as I understand? Yeah, external petrosal is probably a sympathetic branch that is coming through there. But how is it coming out there? Hey, but that is a very stub article, Roshni, that Radiopedia wala. Okay, I'll do one thing. I'll just refer it back and I'll get back on this discussion onto you on the external petrosal and the more accepted version of it from the standard books. Okay, because isn't it? Because it's not an accepted version right now. Now what happens is some book will say this, some book will say let's just get back onto something better. But yes, it could be, you know, if it is sympathetic, if it is sympathetic, then that means it has come, it is already a post-ganglionic and all that. So is it forming plexus over the two arteries? Where has it come from? We have to trace back the source. We just cannot directly say, okay, it's a sympathetic branch and, forms a plexus over MMA, middle meningeal artery. But how, when, where, from where, all that is important, right? So let's just check it out, what it is. Alright? Yeah. So right now we are all clear with this part. The lesser, deep and greater. Okay. Okay, somehow now my class is not getting extended, so it will be getting over by itself in some time. So I think so I may be able to cover up this. Yeah, abduction, if you remember, this was a nerve that was in the center of the cavernous sinus. If my class abruptly ends, okay, okay, this was in the center. So since it was in the center, it is the most commonly paralyzed because it's in the center. If there is a raised intracranial pressure, it will get compressed and it causes internal squint because it's the lateral pterygoid, right? When lateral pterygoid is paralyzed, all the muscles, other muscles will pull the eye into the center. Yes, along with internal carotid. Yes, Hima, you're right. Okay, so all these points are clear. I'll just move on. Okay guys, it's showing me a warning. I think so we'll stop at this thing. And in the beginning of the next class, I'll cover up this thing. Okay? So, yeah. Yeah, good night guys.